Welcome to Halifax Health. I'm John Guthrie, Vice President of Communications, and today I am joined by Danielle Brooks, who manages our orthopedic service line. So Danielle, I want to break down this discussion into a couple pieces. One is kind of what happens the day of and how you get ready for orthopedic surgery. Then let's talk about the timeline and what happens when you're here. And then I know we really need to get to the post-surgery or rehab piece. So we'll get through all those things, but what do I need to know if I am coming in for joint surgery?
You may have specific instructions from your surgeon. You want to follow the specific instructions that they provide you because this is a very generic class that we provide. The first thing is skin issues. So if you have any issues with your skin, whether it be bug bites, a laceration, bruising, an exacerbation of a current illness, you want to be proactive on this end and call your surgeon, ask for the nurse, and let them know what's going on. You don't want to come in the day of surgery and have a big bruise on that joint and then prolong reschedule your surgery.
So if we have anything that's impacting that joint area, so if I have bug bites somewhere else, that doesn't matter, but it's in that general area of where the surgery is going to be that I have to be careful?
I would say if you have any skin issues anywhere on your body, you would want to be proactive and call your surgeon and let them know what's going on.
All right, so that's one thing. What else?
So if you have any sickness or fevers, cough, congestion, respiratory issues, we are in flu season, you'll want to call your surgeon's office. Again, let them know what's going on. If it's an exacerbation of a current illness that you already have, they may want to reschedule your surgery. That way you're going into the OR at your optimal health level.
So let me ask you this. Will most surgeons' offices call you and ask you these things, or is it on me as the patient to call them and tell them?
It's on the patient to be proactive if something arises, the week before, a couple days before the surgery, to call the surgeon's office and let them know.
So if I have a health concern a week before my planned surgery in that window, I should really call the surgeon's office and let them know that?
Yes, speak to the nurse, and that way they can get with the surgeon and ask if it's going to be okay to proceed with surgery on the surgery day, or if they want to maybe see them and then reschedule.
All right, so I'm going to take a general kind of look at my health a week out. If I have any issues, I'm going to call the doctor. So now I'm on some different medications, and I'm assuming the week before or an appointment before, I've given those to the physician.
Correct.
And said, this is what I'm on. Which one should I take? Which one should I not take? And they're going to give me that outline.
So what you want to do is bring your list of home medications that you take and how often you take them, and bring those with you your surgery day and give it to the same-day surgery nurse.
And that will ensure that we don't have any...
Basically, the surgeon will restart the meds that he wants you to take after surgery. You do want to have the conversation with your surgeon on what he would like you to take the day of surgery, whether it's heart medication, blood pressure medication, but that's something that the surgeon will guide the patients into what they need to take. What to bring the day of surgery. So you're going to arrive in the Fountain building. Those doors open at 5 a.m. You'll go to registration. From registration, they'll direct you to same-day surgery. And from same-day surgery, you'll go to the OR. Now in same-day surgery, they're going to give you what's called a 4-digit PIN number. And this PIN number will provide anything having to do with your care, your health, how your surgery goes. And you can give this to a family member if you have someone waiting for you during surgery, and that will give them access to what's going on with you while you're in the hospital. If you do not want people to have access to this information, you won't want to give them that 4-digit PIN number, but it will be provided in same-day surgery by the nurse.
And so that 4-digit PIN number is essential if I want anybody who came with me to know anything about the surgery?
Anything about their health stay that day.
So is that almost like having a healthcare surrogate, or not quite? Or is it more episodic that during this episode, these people will get this information?
That PIN number will just be with you for this day.
Okay, that's good. Then what happens?
So from same-day surgery, you'll go to the OR, and from the OR, you'll go to PACU, which is the recovery unit. And from PACU, you will come up to 6 North, the orthopedic unit.
All right, now I have some questions because that happened really fast. All right, so I'm going to go to same-day surgery. What are they going to do to me in same-day?
So you're going to get an IV established, you're going to get in your hospital gown, you're going to meet your same-day surgery nurse. You're going to probably see your anesthesiologist to go over your health history, and possibly the surgeon or PA to go over the procedure with you.
So they'll go over all that, plus they're going to ask you why you're there, and they're going to actually mark the joint right beforehand,
Yes.
so they know that they're doing exactly what you want them to have done.
Correct.
Okay, so you go through that and they get you all ready. When do they put me to sleep?
So they'll put you to sleep. They'll probably give you something comfortable in same-day surgery, but they'll start to give you the medications to put you to sleep when you're in the OR.
All right, and now I love the fact that you say same-day surgery. Does that mean that surgery is going to happen that day and I'm going home that day?
No. So normally you will, depending on what total joint you have, your health history, you will, that'll be determined on your process after surgery. But most of the time, you're at least going to stay a day or two after your post-op day 0.
So we're in surgery, and how many people are in that surgery with me? When you look at the physicians and everybody else, is it a team?
It's definitely a team. So you've got your surgeon, possibly his PA or ARNP, your anesthesiologist, your surgical tech, your circulating registered nurse.
That's my whole crew.
You've got
Gotcha.
a decent team there, yes.
And then how long for the average surgery do you think?
Well, I would say it's about 1 to 2 hours.
1 to 2 hours. Okay, so I've had surgery. It went great. We're hour and a half because I like to do things quickly. And then where do I go?
You're going to go to PACU, which is the recovery unit. And you'll stay here until your vital signs are stable, you're starting to wake up, and then depending on when 6 North has a bed available, you'll be transferred to our orthopedic unit.
So pretty much right afterwards, how long is that period of time in PACU probably?
So we do try to get you up to 6 North within an hour or two
Oh, that's
from when
good.
you become stable.
That's great.
Yeah.
So they transfer me up to 6 North, and I'm in my room. Can I have a visitor now?
So all of our rooms are private. You'll have your own bathroom, shower. We have a pull-out sofa, and you can have one visitor stay with you, and we'll provide all the sleeping arrangements that they may need, pillow, blankets, sheets, and they can stay with you your hospital stay.
And how am I going to feel at, 3 hours after surgery? Am I going to be groggy? Am I going to be alert? How will I feel?
So it's definitely patient dependent, but normally people start to wake up in PACU. Sometimes the physical therapist, and I know we'll move into this, but physical therapy sometimes even works with patients in PACU, gets them up, moving. We will control your pain if you have any nausea. The nurse will be there to, do any interventions that she needs to do in that sense. But it's patient dependent. You may take a little longer to wake up. You may, be up and ready working with physical therapy. It just depends on the patient.
So I might be up and working with physical therapy same day.
All the patients will get up the same day
Wow.
of surgery. It is best practice to get that joint and that muscle up and moving as soon as possible.
So I'm going to talk with about rehab later, but let's say the day of, I'm up, I'm moving about. What happens next as far as discharge, and how soon do I get to go home?
So every day after your initial surgery day, you're going to have your labs drawn at 6 a.m. every morning. It'll test your blood levels, your hemoglobin, your hematocrit, make sure all of those are stable, your electrolytes. You'll see your surgeon post-op day 1, which is the next day after surgery, around 6 a.m. They normally around 6 a.m. to 7:30. So if you have a family member or someone that wants to be there to see the surgeon post-op day 1, just let them know that's the time that they're normally on the unit with their PAs or ARNPs and rounding.
So that whole team is going to get together
Correct.
and make sure that I'm making the right transition to whether it's home or to a skilled nursing facility or wherever.
Correct.
Excellent. Then what happens? So then am I discharged?
So if the surgeon comes in 6 a.m., everything looks good, and they say you're going to be discharged today, you'll get a morning session with physical therapy, you'll eat lunch, and then you'll see physical therapy again in the afternoon. And a lot of times the nurses are really good about getting your discharge paperwork to you, taking out your IV. So after that afternoon session, we'll put you in a wheelchair and wheel you down to your family.
That sounds great. So let me ask you this final question. What do I do if I have questions? Can I call the floor? Can I talk to you? How does it work?
Absolutely call 6 North and ask to speak to it. Doesn't have to be that nurse for that day. It can be the charge nurse. It can be myself. But we do give the patients the 6 North direct line. So they are able to call us if they have any questions,
So
especially
you're
after
always
discharge.
there for me.
I'm always there for you.
Now, what can happen if there's some type of an issue? What can happen after the surgery that I need to really be cognizant of?
So post-op complications consist of the development of a blood clot as well as pneumonia. So we do things on the nursing end and teach the patients interventions and things they can do to prevent any of these complications from happening. So when they come out of surgery, they'll have what's called a TEDHO on both extremities, and this will help to keep that blood flow going. We'll also connect them to what's called a sequential device, which inflates and deflates and keeps that blood moving as well. We'll also encourage them to do ankle pumps, 10 every commercial while they're in bed watching TV. For the pneumonia complication, we have what's called an incentive spirometer, and that is at the bedside when they arrive to the room. Our respiratory therapists normally do the initial education on this, and then nurses do the reinforcement education on that, and we will send that home with the patient.
So the way to avoid those two issues is to keep the blood and the joints moving as much as possible, and you have machines essentially which will help do that. And then really exercising the lungs so that we don't get fluid buildup.
Correct.
Okay, that's good. All right. I think that does it. Is that all we have?
That's all we've got.
Thank you very much. We hope this is informative. We hope this makes it so you don't have to come into the hospital twice. You can watch this at home and be ready for a great surgery.